Hi guys, welcome to another episode of Health 210 podcast. This is your favorite doctor, Dr. Mansoor. Today, it's a little bit different. So for the first time on our podcast, we do not have a physician. But that does not mean it's not important. We have probably somebody more important than a physician. Somebody who actually lets physicians do what they need to, provides all the resources, the building, runs them, and then makes that structure for us doctors to do what we need to do. So a close friend of mine, Megan Cool Amalakuhan. So it used to be Megan Cool. Then she got married to one of my closest friends. And now she's a little less cool. Right, Megan?
That's right.
Well, welcome,
That's right.
welcome to Health 210 podcast. Megan, I'll start off with you introducing yourself to my audience, telling them who Megan Cool is.
Right. Megan Cool Amalakuhan.
Megan Cool
Amalakuhan. This is good. It's good. No, thank you for allowing me to spend some time with you tonight.
Yeah.
And we've been trying to schedule for a bit, and
it took just 2 months.
Yeah,
just
that's
2
okay.
months.
That's okay. That's good parents, right?
Yeah.
It takes a long time to get things set up. But thank you for having me on.
Yeah.
Love that question. Who's Megan Amalakuhan? I think the wonderful thing about being in San Antonio is it's been a great last 10 years.
Okay.
So I'm originally from the Nashville, Tennessee area.
Okay.
Grew up in a wonderful, suburb of Nashville, Tennessee.
Okay.
So, yes, I am stereotypical of loving country music and the outdoors and all those different things. But switching to thinking about how that really helped me in my career, I think that it was really divine intervention.
Okay.
When I was thinking about college, and I don't have anybody in my background that's in healthcare.
Okay.
But I think I grew up with parents that had a really good thought around being responsible for others.
Okay.
My father was an early careerist in the military.
Okay.
And my mother always really focused on taking care of other people. We had family members that needed extra care, and
she was the main family person.
She's a main family caregiver. Even had her own childcare business for a while. So I think I grew up feeling about what is part of our purpose, and through taking care of others and being responsible. So through college, I think. HCA, which is actually this month I've spent 20 years with them.
Oh, wow.
My entire career. Built a hospital, and I started to see how it transformed the community.
Okay.
And so I was finishing up college, and, I don't think I was able to articulate it at the time, but I really had a desire to be in the humanities.
Okay.
But I was missing a piece around science. So I don't have that. I don't have that competency, but I have more math and more pattern. And so I got an opportunity to interview in the accounting and the business area, and I just jumped on it. And what that really did for me was that it combined, the desire to be part of the humanities, but I had more of that math aptitude, and really understanding how that plays into relationships. Okay. So if you think about math and you think about study of that, it's the study of patterns and relationships.
I was very weak in math.
Yeah. That's okay. You figured things out, right?
Yeah.
Anyways, and so I think that what the healthcare industry and the hospital industry has done now for the last 20 years for me is it's allowed me to really be part of something that really transforms people's lives.
Yeah.
And I was really blessed that I found that very, very early in my career, and very early in being able to do those kind of things. Okay. And so fast forward, I was with HCA Healthcare and a accounting.
Did you start HCA Healthcare in Texas or back in Nashville?
Back in Nashville. So right at 22.
Oh,
so
wow.
Straight out the gate.
All right.
And anyway, so I had some roles there for about 4 years in accounting and finance capacity. And then I got an opportunity. I call it my residency.
Yeah.
So I traveled for 4 years and went all over the country and did what they were called performance improvement projects. And so I led teams. So I got to visit over 30 different hospitals.
Oh, wow. Okay.
Which meant I got to meet, 30 different medical staffs, 30 different leadership teams in my late 20s. And so it really taught me that experience about how to really influence and try to gain trust and collaboratively find wins for each other.
Okay.
And that was part of just my learning of, you think about what we do today, and even in the role as a CEO, you really have to do things through partnerships.
Yeah.
And particularly with the medical staff.
It's all about relationships.
All about relationships. So I think that was really pivotal for me. And then I got an opportunity to do that type of work in Texas. And so I was in Austin for about a year and a half as a vice president, doing that type of work, and then got the opportunity 10 years ago to come to Methodist Healthcare. And
that was when you came to San Antonio.
So when I came to San Antonio, so I was at Texan and got to experience that wonderful hospital. Then I got to experience Metropolitan.
Okay.
Loved that hospital. Actually thought I was going to be there for a little while longer as a COO. And then got this absolutely transformative opportunity to open Methodist Hospital Westover Hills 2 years ago.
Yeah.
And which is a fun chapter in my life because I got to interview 6 months pregnant.
Yeah.
And so that was, I think a testament to where we're at today and women in leadership.
Yeah.
I was seen as somebody who was a great fit for the role, and it wasn't, even thought about that that would be an issue, of that. So anyways, so really, really supportive now boss and allowing me to interview for that. So and then got to open the hospital in 2024. So,
Perfect.
Yeah.
Perfect. Did you always know that you wanted to go, like we talked about the travel, the college, the HCA part, but it's CEO where you wanted to be?
I think when you get into these type of roles administratively, you start to see yourself in different pathways of how can I better be of service?
Yeah.
And so I don't think that it's necessarily my path was, 20 years ago, I looked at the CEO of where the hospital was like, I want his job. I think for me, it was more of, okay, what can I learn? How can I figure out how to be more of service to this organization? Because the better I become at that, the better this organization becomes at providing, exceptional care to the community. So there was a time, I think after about 10 years, and I'd done, I call my residency and that travel work, that I really felt like I was led to go back into the hospital. And that's why I came to San Antonio. And so, I think when you have the right sponsors and you have the right mentors that can show you the path of skill development, that can lead to where you want to be. And so certainly as a COO, it's a great opportunity and just kind of a privilege to be able to be a CEO. So, yeah.
Perfect.
Yeah.
And it's been 2 years?
It's been 2 years.
They went by pretty fast because I just remember coming to the opening.
Yeah.
It was like yesterday.
It was. Yeah. We're about to celebrate our 2 year, my 2 years. Yeah. Of opening in November 13th. So.
And it started with very few beds. And now we're like a big hospital, right?
Yeah. So little bit of course, about Methodist Healthcare's investment in Westover Hills has been actually, many, many years going back. So the land actually purchased for Methodist Westover Hills, that campus, was purchased at the same time as the Stone Oak campus.
Oh, wow.
So over 15 years ago, Methodist really wanted to invest in that area. Fast forward to about 5 years ago, the freestanding ERs were built, the 3 out there, a couple of urgent cares. There's physician clinics that are affiliated. So I think that
place has really exploded. It's like developing population-wise too. There's immense traffic there.
Yes.
Yeah. And there wasn't a hospital before.
Correct.
And now we built, there was a new Baptist developed there too, and the Methodist. So it's becoming a new mini healthcare system.
Yeah. I call it Med Center of the West. Nobody's taken my term yet, but so the hospital is really just a demonstration of that commitment to Methodist Healthcare, to the Westover Hills community. So we've started off with 54 beds, right, and really just hit the ground running. I think what we underestimated, maybe in a good way, is just the amount of demand that really is looking for Methodist level of excellence in the area. And that really are just happy to have, care where their loved ones are and where they work and where they live. So we're excited about that. We do have hopeful plans to continue to expand. You know, I think the campus is set on 85 acres.
Yeah,
and
it's
so
a huge place. Yeah.
Beautiful. And so that gives us a lot of possibilities, you know, just like we've, committed to a hospital, we built the hospital. I think, it's no doubt that we're still committed to adding more beds and adding more inpatient service lines as we grow.
And I think it was the same way for us when we opened our Westover clinic. We were not expecting the growth to be this fast, but I'm glad that our building is also on a larger scale and we are expanding rooms too. The growth around that area is just like, it's really crazy. But yeah, I mean, I've had my own share of experience of Methodist system. I've only worked in Methodist system. Probably what's missing from my path is Texan. So I did Metro, and then I went to Stone Oak, and Stone Oak's missing on your path. And I've been at Stone Oak now like almost for 8 years. But if as a physician somebody was to ask me, I wouldn't change Methodist. I would always work at Methodist. So Methodist does play a big role in, I feel, San Antonio or Texans' life. And as a physician, and probably now I'm getting that from a CEO, I feel like it's just a different level of care. And that's what patients want. So we were very happy when Westover opening was decided. I was very happy when you were declared CEO there.
Thank you.
And I kind of knew that process was going on. So when your interviews were going on, Braveen, your husband, my one of my closest friends, he was very tense. So I went through that path. That was pretty cool. And we were all happy about that. All right, so move towards a little different side. I have a daughter. She's 12. So when I see you, I see like there's perspective that is not just being a physician, but in another career path, which is similar in healthcare, but still different. How do you feel the challenges for women are now?
I've been really lucky that I feel like in my entire career, if I was the best person for the role, I got an equal shot to it, and I was given the opportunity based on my merit. And I've not felt that, and
that's good.
And I think a lot of it has to do with, and maybe it's my own mindset. I will say, as a person who's a working mother, I have, of course, now 2 kids under 5. My husband, of course, is a very busy private practice physician who also works out of the house. I think our strategy really is around having support. And I think people say, well, are you, is it 50-50? Do you have, sometimes it's 80-20. Sometimes I'm giving 80. He's giving 20. Sometimes he's giving 80 and I'm giving 20. I mean, even like tonight where, I'm with you, he's with our kids. And so I don't think we have an expectation that, there's a perfect solution. I'm very, very blessed that we have help and support, at home with our nannies. And that's what works for us. I think for women who want to pursue something, and I give this advice all the time, is you can be realistic about what type of support you need to be successful. And, I don't ever say that you're not going to have any guilt. I heard a quote once about, no, you're always going to be juggling. As a parent, what you have to learn is when you're juggling, if the ball is plastic or if it's glass. So you drop something, it'll bounce. If you drop something that's precious, it'll break. And so, those are the things where you have to decide, who's going to go to, a performance at school. For example, I missed Mother's Day muffins this year. And, still I sent our nanny, and the kids loved it and they felt loved. They just really wanted sugar. So that worked out. And that was something that, I had already had a speaking commitment. But then, there's something coming up soon, and, and I didn't miss that, so it's just those types of scenarios where you just have to think about, do the best you can, and with your family. And I think you kind of figure out, what's glass and what's plastic, and really just partner up and figure out what works for you. So
that's a pretty honest perspective. And I think, as a parent, but a male, I get that guilt element too.
Mm-hmm.
If you are going to be busy in your career, there's always going to be that. And I always wanted to know what the female perspective is, because that mother element comes in too. But if you have to be, I think that's the best way to put it. There's plastic and glass. So like, you got to choose something sometimes.
Mm-hmm.
And you sometimes do get that guilt feeling.
Mm-hmm.
And that I certain times I just say to myself, it's okay. You can't be that tough on yourself. Because honestly, there's not that many CEOs.
Mm-hmm.
There's only a few. And if everybody could do it,
Mm-hmm.
they would.
Mm-hmm.
So that's a great perspective. I'm going to start using that term.
Yeah. The other cool thing, though, and just talking about progressing through the industry, I think what's been really great, at least in my career in the last 10 years, there's been a lot of females that have had an opportunity to advance. And had gotten, on merit to where they were, and in my field, to COO roles, and have really been chosen because they're the best candidates. I think that one of the really cool things about Methodist Healthcare, so we have 4 female CEOs.
Okay.
And which is 9, I think that's 9 of us in total, and 4 of us are female.
Overall
for the system.
Oh, wow.
Yeah. You're not going to find that very often.
Yeah.
I think, shout out to my boss, Dan Miller, our president, for being very intentional about that, because I do think you have to be intentional when you look at that. And anyway, so we're very blessed that he's thought through that process for us.
That's pretty cool.
Yeah.
And it makes us feel good too, because we work with Methodist System. So to have 9, that's a big number.
Yeah. 9 CEOs and 4 female.
Wow.
Yeah.
Okay. Yeah. That's almost 50-50.
Yeah. Right.
Yeah. Maybe one more come up. Right?
That's right.
Yeah.
We'll get there.
We'll get there. Yeah. So Megan, we were hospitalists, and then we converted into primary care. We have a great relationship with the hospital side. I wanted to see your perspective. What do you feel about the primary care world? Because you're in the hospital world. How does that link up for you?
Yeah. I think that we obviously both have a very closely shared mission. To provide, high quality care to patients when they need it.
Yeah.
And we may deliver care a little bit differently.
Right.
We're very much connected.
Yeah.
And so I think that, access for patients and easy access for patients is, I think, a hallmark of how we are both very successful in what we do in our industries that are connected. So, when I think about the care continuum for a patient, if we both want what's best for them, we want to make sure that we're coordinated.
Right.
And I think that there's, we've made a lot of great inroads on making sure that we're connected from your patients. You get information about your patients if they're in the hospital. We're making sure we're communicating with you when they're out of the hospital. We really want to make sure that we're connected on the high quality specialists that we both use.
Right.
And, we just want to be there when our patients need us.
Yeah.
And you're really there to build that relationship with them. And, unfortunately, if they need to go to an emergency room, we want to make sure that, your patients know where to find us and we take great care of them. So I think that the biggest thing that we want it to be a really great relationship. Right. We want to make sure that, you have the information you need to do great work, which you all very much do. And I think there's been, I think you have a really unique perspective in your primary care clinic because you guys have spent time in a hospital.
Right. And we still do.
Yeah. And so you kind of see, the efficiencies and also the challenges of transitioning care from the outpatient setting to the inpatient setting. And going back in there. And so I think partnerships like ours, where you can give us feedback, we can give you feedback, because we both want the same thing, what's best for our patients.
Exactly.
So I do think that the primary care and the inpatient side have a really, great opportunity to strengthen the community and really provide great outcomes for patients.
And I think that was the idea that we had personally, as we were traditionally hospitalists. We've done it for many years, to come into the community, because we see what people come in the hospital with. And I get it with you. Like, I agree, access and communication. Those are the two things. And we feel the same way for the hospitals. Like, if I have a good relationship with the hospital, I mean, if I have a problem with my patient, I need them to go to the hospital, and there's like no beds. Their emergency is really busy. I know that at Methodist, for example, I can even call you, be like, hey, Megan, I have this patient that really needs to go. And that has happened in the past, and we've arranged the bed and everything for that. So same way coming back, there's a patient who needs a closer follow-up. After the hospital, they don't have one. You guys have communicated that back to us. And I think it's all about that easy access, communication. So yeah, I think it goes both hand in hand. And you're right. We had a little bit of different perspective than usual primary cares, because we've seen the other side. So I think we're also same way trying to build a better bridge. And I think we'll keep working on it. Yeah. And then, which brings you to Methodist again. You're at Westover, but you've kind of worked at different places, like you said.
Yeah.
What is the future that Methodist thinks as San Antonio is growing? Any future plans, or innovations that Methodist wants to bring?
Yeah, I think the great thing about Methodist Healthcare is they're going to stay true to their mission, right? And we are as an organization. And really thinking about how best we can drive exceptional, cost-effective healthcare accessible to all.
Perfect.
And so if you think about our future and our strategy around those three things, we have lots of things going on, right? You think about being exceptional. We want the best possible outcomes for our patients and their families. And so, the future looks like us continuing to strive for excellence in that, exceptional with our colleagues and our medical staff.
Yeah.
So we want to be the place of choice to work. We've got 11 hospitals, a couple rehab hospitals, lots of urgent care centers and ambulatory care centers, physician partners. And so we want to be, if you're choosing healthcare, if you want to get into nursing, we want to be with you through that whole decision making.
Yeah.
We even now have the wonderful GME residencies.
Yeah.
So investing in the workforce, we think, and being a great partner there, not just buying schools or loosely affiliated. We're driving exceptional work environments for our colleagues and our physicians.
Yeah, and I think I was doing this read on about the amount of jobs Methodist has created in San Antonio. It's, I think, the top most, maybe after USAA. I think Methodist is actually the number one place for a job. So it's a great, having it locally and the expansion. And you're right, it's literally in healthcare's every system, rehab, nursing, now even the medical school or a residency program, and then GME studies for which your husband is a big part of. And Praveen shares that with us, and we're going to have more residence training with us too.
Great.
So and I see it the same way, and that's why, like I said before, I've been blessed to start my career in Methodist. Hopefully I can end it there. But so far, I've been very happy with Methodist overall.
That's great.
We'll take off to a non-serious part. Dr. Faraz, as you know, loves to make rapid fire questions for us.
Great.
I haven't even seen them.
Okay.
So this is going to be fun. What you do is, as best, it's not a yes or no. It's not like some of them are yes or no. Some of them are true or false. Some of them are just a little bit of one-liner.
Cool.
So whatever comes to your mind first, we just go by with that. So first question, and I think it's a CEO-based question.
Okay.
Coffee or green smoothie before a board meeting?
Oh, coffee. Caffeine all the way.
All right. First word that comes to mind when you hear the word epic?
Oh, vacation.
Epic. All right. Most underrated role in a hospital operation?
Oh, don't. So, oh man, that's hard for a rapid fire.
Yeah.
There's not one. We don't invest in a workforce position that isn't valuable. who do I think maybe doesn't get to shine always because of maybe the location of where they're at or something. I'll probably have to say our environmental services team or our lab team.
Yeah, they're not at the front, so like they don't get that recognition that way. Yeah, well, that's a good answer. All right, I agree.
Yeah.
The hardest part about being a hospital CEO. I know it's a broad question.
Wanting to be in lots of places at one time.
Okay, so maybe having different like
prioritization,
twins, triplets of yourself.
Yeah,
right?
It's prioritization. I mean, everybody struggles with that
because you need to be at many places at the same time, especially within even the same hospital.
Correct.
Right.
Yeah.
Okay.
Yeah.
And same part about being a CEO, most rewarding.
Oh, gosh. It's a privilege to be part of people's lives. And I get to do that directly with my leadership team. And I get to see patients every day. And so there's not a lot of places that can fill your cup by just showing up. And there's beautiful things that happen in the hospital every single day and every single moment.
Yeah.
And with our patients and the people that are there for work.
Yeah, with the staff. Yeah. All right, continuing with the rapid fire, Megan. If you were to go back in time to a 25-year-old yourself, what advice would you give?
Yeah, love that question. And I have a great quote that I lean on. And it's, you may not have ended up where you intended to go, but you'll end up where you're supposed to be.
Beautiful. Okay.
Yes. And I think that really speaks to the fact that be open to different growth opportunities. I think everybody at a point in their career has a great plan laid out and they're headed down that plan, and things come up that may challenge you to grow or look at things differently. And I think you should definitely be open to taking those. I always think too that, all the best laid plans that you have out, God takes those plans sometimes and he crumbles up and he gives you a better one.
Wow.
And that's how I think I definitely ended up in San Antonio and in this wonderful position.
Wow. I had a different answer for my 25-year-old, but I'm probably going to copy yours. Yeah. All right. So I'll say a few more. Most memorable aha moment.
Oh.
Whatever comes in your brain.
Oh. Getting pregnant.
All right. Yeah. I mean, that is.
That's always a very memorable moment.
Did Praveen come and say aha?
Yeah.
All right. If Methodist had a theme song, what would that be?
Oh, a theme song?
Yeah. I don't know what opening song or inspirational song, whatever.
Oh my gosh. Okay. The only thing I could think of is my last walkout song that I had last year was Cowboy Carter. Anyways, I thought that was
that's Nashville, Tennessee.
Yeah, right. Okay. That's a good combination. Strong female and loves Texas.
Okay,
so there you go.
As a CEO, any book you would recommend for everyone to read? One book.
Oh my gosh, one book.
One book.
Well,
I know you CEOs have many.
Yes.
So one.
Can I give you?
Two?
Can I give you one? I would say if it's the only thing that you could ever read.
Yeah.
But I'll tell you one that I'm really interested in right now is the AI-driven leader.
AI-driven leader.
And it's a book that's starting to how can you use the tool of AI? Obviously, it's a little bit different with security things and all of that for us in healthcare, but it was really informative for me to think about how I can take myself to the next level with tools that exist today to make myself more effective, the team more effective, and just learning the basics of that is going to transform leadership. Okay. And those that can adapt and learn those skills earlier are the ones that are going to set themselves apart. So anyways, that's something I've just picked up recently, and I think it's really, really interesting.
Yeah, and AI
for us.
It is the future. So yeah, that's pretty cool. Megan, thank you so much. After 2 months, we were able to do this. Again, I say this: you're the first non-physician, and I'll say probably, I think we're gonna beat the rest of the podcast, especially Braveen's. I'm gonna give him. I'm gonna send him a text about that. But thank you so much for coming, and good luck to your career. I've literally seen it happen in front of my eyes, and I want to continue seeing you grow.
Yeah.
Thank you so much.
Thank
you for being here. Thank you
so much. And thanks for having me. I think that it's been even just being, open and thoughtful about our partnership.
Yeah.
We have a friendship, but I think, you've done a really great job embodying how partnerships can look really well.
Yeah.
And between administration and the hospital and our medical staff. And so thank you for that.
Perfect. Thank you so much.